I'm Shelby Cullinan with your latest health news. C-sections are procedures to deliver babies in which the baby is surgically removed through the mother's abdomen. C-sections are usually performed due to some problem with delivery. These problems can include the baby being in an abnormal position or displaying signs of distress, among others. However, this procedure has become extremely common in the U.S., and new evidence suggests that this might be dangerous to women and babies in some cases. In a recent report, the World Health Organization, or the WHO, stressed that cesarean sections should only be performed when medically necessary. One study from the Cork University Maternity Hospital in Ireland identified a potentially increased risk of stillbirth or ectopic pregnancy in later pregnancies as some possible additional risks from C-sections. However, the increased risk was extremely small, and it was not clear that the C-section itself was responsible for the increase. Elise Weis, past president of Lamaze International, explains other possible risks C-sections might carry for an expectant mother.
The immediate risks for mom after a cesarean section include bleeding, infection, and blood clots.
Another study, this one from the University of Minnesota, pointed out that the rates of C-sections across the U.S. varied a great deal from one hospital to the next. Why is this? The researchers concluded that the reason must be related to vast differences in practice patterns. In other words, different hospitals must be using different practices for similar situations. When needed, the procedure can save the lives of both mothers and babies. C-sections are often thought to be safe. However, the WHO explained that in cases where C-sections are not needed, they haven't been shown to help women or infant mortality rates. So what can you do? Be informed, ask questions, and make sure you understand your situation.
Ask, what are the alternatives? What are the other things that you could try short of a cesarean section? Is there a way to have a second opinion? If you have to have a cesarean with this baby, what are your chances of having a vaginal birth in subsequent pregnancies?
Despite the concern about the rising rates of C-sections, the WHO stressed the importance of handling each birth on a case-by-case basis and called for a universal classification system to better assess C-section rates across the globe. If you're expecting and have questions about your pregnancy and the birthing process, make sure to speak with your physician or OBGYN.